Welcome to the other side of medicine. I'm Dr. Krystosik, aka Dr. J. Glad that you're taking the time to join us this evening. We have a special treat for you tonight. Some of you may be familiar with what the topic will be about tonight. Some of you will be quite surprised. We're going to be talking about the oral health and specifically the bacteria called the microbiota living in the mouth, the microorganisms living in the mouth. We'll be discussing that with a dentist who practices a very interesting form of dentistry, a natural form of dentistry. She's a doctor that has graduated from Case Western Reserve Dental School. Her name is Dr. Skordeles. She'll be joining us in a few minutes. And Dr. Skordeles, Dr. Christine, as she likes to be referred to, is a native of Cleveland, and she ended up doing her residency in New York City and then started her practice there, and that's where she's been. But my friends, you'll be glad to know that she's going to be opening up an office here in Medina, Ohio. We'll talk about that tonight as well. But before we dive in and meeting Dr. Skordeles, I want to talk a little bit about this topic of the oral microbiome. Now, many of you are familiar listening to the other side of medicine. And of course, if you're a first-time listener, you have heard about the gut microbiome. The bacteria living inside of our gut has become a very, very dominant topic in nutritional field, in the field of healthcare, natural medicine, functional medicine today. It is the buzzword. The gut health has become paramount in so many illnesses. And most people don't recognize that our mouth has a lot of bacteria, over 700 different types of species of bacteria living in the mouth. And the oral microbiome is the second largest microbiome in the body. First is the gut, has the most bacteria living inside it, and then the mouth, which a lot of people don't understand. And we're going to talk about the significance of that tonight and how the bacteria in the gut and our health of our mouth, the oral bacteria, communicate with each other. They literally crosstalk with each other. It's called the gut and the oral cavity access. And we're going to get to discussing about that tonight and the significance of that. So we've got a lot to talk about. And the immune system is affected by the bacteria living inside of our mouth, and the health of our mouth and the gut, bacteria living inside of our mouth. The immune system is impacted in a profound way by that. Also, entire body is affected by it. Researchers now are literally showing a connection between the bacteria living in the mouth and all of our body systems. So our lifestyle factors, we're going to get into talking about that tonight, how our lifestyle, how we think, what we eat, how we move, our food choices, all these things play a significant role in the health of our oral cavity and the types of bacteria we have living there. And so take some notes tonight, because our special guest, Dr. Skordeles, is very wise in this area and one of the leading dentists in our country. Dr. Skordeles, welcome to the other side of medicine.
Thank you, Dr. J. I appreciate the invite and the honor to talk with everybody. And it's going to be like a little fireside chat tonight. I'm really looking forward to all of the really great stuff that you're talking about. I'm a native Clevelander, and I ended up in New York City doing my residency program and ended up staying. And it's been a wonderful experience because I've been able to be in contact with some of the best doctors in the world, lectures, and exposed to so many cultures and so many people from everywhere. And one common theme is when patients doesn't matter where they're from in the world, could be the smallest place on the planet, when they have really good mouth care and really good diets, Their gums reflect it, their teeth reflect it, and the rest of their body actually stays healthy. And I have been fortunate enough to be practicing in this preventative mode for my entire career in New York. And I'm now going to be bringing that to Medina and bringing in the connection between being a biomimetic, which means following nature doctor, and doing very conservative treatments as I'm following nature. And at the same time, I'm connecting all of this back into preventative, if you will, preventative dentistry and medicine that is linked in with all of our lifestyle factors and what we do in the office and what you do at home on a daily basis. So these are the things that are really, really important. And our oral bacterias are affected essentially by absolutely everything that we place in our mouth. And it's also how we think too. And
well, you know, Dr. Christine, I'm going to call you that, right? Is that okay?
Yeah, that's fine. Thank you.
So you've been a trailblazer in this area of the oral microbiome. How important is that to the health of our teeth, but not only our teeth, to the rest of the body, the entire body?
So when you have an imbalance of bacteria in the mouth, for instance, when you're on a high sugar diet and you have very acid-loving bacteria in the mouth, those acids are secreting, those bacteria are secreting acids, and those are what are causing you to have tooth decay. They're causing you to have tooth inflammation. They're also the change in your in your daily routine, so to speak. So when you have the highly sugared or highly acidic energy drinks or all of that kind of stuff, that every bit of that affects you, whether it's first thing in the morning or the last thing that you do at bedtime. All of these factors affect what happens in our mouth and the bacteria in our mouth. There are bacteria that actually secrete nitric oxide, and research is looking for ways to increase those nitric oxide loving bacteria in the oral cavity, because what does nitric oxide do? It helps regulate, it's one of the regulators of our blood pressure. So if you have low nitric oxide in your bloodstream, your blood pressure is going to be very, very high. So there's so many new things that have happened since when I graduated dental school more than 25 years ago. And back then we knew that there was oral systemic things that were happening in our body, but we couldn't put the links together. Now we're able to put those links together. And that's really, really important for people to understand.